My name is Dr. Muhammad Shukri bin Jahid. I am the head department, Department of Surgery, Hospital Sungai Buloh. I'm also the chairman of the Nutrition Support Team, Hospital Sungai Buloh, and the president of Parenteral and Enteral Nutrition Society of Malaysia. Parenteral nutrition is a formula where all the macronutrients and micronutrients is being formulated in fluid form, and these are meant for patients who cannot take normally per oral. So this formula will be infused to any part of the intravenous access on the patient.
All the parenteral nutrition bags collected from the pharmacy should go through the compounding process so that the specific additives, vitamins, and trace elements needed by each patient are added into the bags.
Hi, I'm Lee, pharmacist in charge of Aseptic Unit, Hospital Sungai Buloh. And here we are in a certified clean room facility in our hospital. All preparations of parenteral nutrition requires a clean and controlled environment, which we refer to clean room facilities. Any additions which include any additives, vitamins, trace elements require strict aseptic technique at all times. Hence, it's very important for all the personnel involved from ordering to delivering of parenteral nutrition to be very careful when handling all the parenteral nutrition products.
The preparation of parenteral nutrition bags is a very meticulous and organized procedure. It is prepared based on a specific compounding procedure, beginning from administration to weaning off the infusion. A proper handling of parenteral nutrition therapy starts from the collection of parenteral nutrition bag from the pharmacy counter. Nurses are required to check the patient's information, collection time, and expiration date on the bag, and cross-check the information on the ordering sheet during collection. Parenteral nutrition bags should always be delivered using an insulated box to ensure no increase of temperature, no contamination, or damages to the parenteral nutrition bag.
There are two common mistakes that normally occur during delivery because usually clinician thinks parenteral nutrition is only the connection of this parenteral nutrition bag to the patient, but actually the process is more than that. So the two common mistakes during delivery is, number one, the delivery time. So all personnel that is involved in this delivery of parenteral nutrition has to actually understood what is the pickup time, what is the delivery time, and what is the hang time. So all this timing has to be accurate so that we do not tamper with the formulation and the cold chain is not being breached. Mistake number two is that a lot of our staff or medical personnel is actually doing multitasking. So when they are en route to actually pick up the parenteral nutrition from the compounding facility in the pharmacy department, they are also en route to other jobs. For example, collecting other medications, collecting blood, sending patients to other facilities in the hospital. So this will involve the parenteral nutrition being carried all around the hospital. So this is what I mentioned in the first mistake just now, the cold chain is being breached. What are the things that we have to be very careful about is you must always remember about aseptic technique. You must always remember about the cold chain that is involved with regards to handling of the parenteral nutrition bag, and you must always make sure that the timing is correct when it comes to delivery, picking up, as well as hang time. The other thing that the nurses need to know is actually whether the pickup time is actually more than 2 hours than the hang time. If it is more than 2 hours than the hang time, the bag has to be placed in a well-cooled refrigerator around 4 degrees to 8 degrees Celsius. If the pickup time is less than 2 hours, then from the hang time, then the TPN bag can be placed on the working trolley. You don't have to keep it in the fridge so that you can keep it in the room temperature before the hang time. The other thing that the nursing staff need to know is actually the information on the TPN bag has to match to the patient where this TPN is going to be infused.
Before delivering the parenteral nutrition bag to the patient, there are several important factors to be noted by the nurses. First and foremost, before starting the administration of parenteral nutrition therapy, nurses should don personal protective equipment, including mask and apron. This is followed by performing proper hand washing techniques to ensure elimination of bacteria. Next, the working trolley is prepared prior to placing the parenteral nutrition bag on it. Begin by aseptically wiping the surface of the trolley using the zigzag technique, followed by putting the drape on the trolley. Subsequently, the nurse has to prepare and ensure that the complete set of items for the administration of parenteral nutrition therapy is lined up on the trolley. The nurse should cross-check that the information on the parenteral nutrition bag corresponds to the information on the patient's risk tag. This is to ensure the patient is given the correct parenteral nutrition bag. One nurse is responsible to check if the bag collected from the pharmacy is in good condition with no signs of leakage. It is advised that nurses should always work in pairs to prepare the parenteral nutrition bag for the administration. The other nurse also needs to unpack all the required items which were placed on the trolley in order to avoid the administrating nurse from contaminating their hands after performing hand hygiene. The administrating nurse is responsible for initiating the infusion of parenteral nutrition to the patient. While initiating the infusion, each step must be carefully carried out by the nurse to avoid infection, which leads to fever or sepsis. The steps include: connect tubing to filter, sterilize the PN ports with alcohol swabs, attach tubing to PN ports, prime tubing, swab catheters, flush catheter with saline, connect tubing to catheter, connect tubing to infusion pump, set infusion rate according to the information on the PN bag. A safe delivery of parenteral nutrition includes the last step, which is weaning off. As the solution depletes, inform the patient before terminating the infusion. The termination steps start from stopping the infusion pump, disconnecting the tubing. Remember to clean the injection ports with alcohol swabs before and after every infusion. And replacing it with a stopper. This simple cleaning step, if missed, might cause infections, allergies, or complications to the patient. As mentioned by Dr. Shukri, different types of catheters have different lifespan and usage. Therefore, the nurse should be aware of the duration of the central catheter which has been inserted to the patient and noted on the dressing, so that they are aware of the next change of dressing. Besides the usual cleaning steps, chlorhexidine 2% is recommended to be used in this process for skin preparation, while transparent semi-occlusive dressings are the optimal dressing to be used for ease of visualization on the patient's skin. Most importantly, do not forget to note down the next date for dressing change so that other nurses would be aware too.